global controls will have to be imposed, and a world governing body will be created to enforce them. Crises precipitate change.
Secretly plotting your demise. I want to devise a...
Hello everyone, Darko 2012 here with Global Government News. I am reading an article that's titled "It Has Nothing to Do with Healthcare," and this is from newswithviews.com, and this was posted on March 24th, 2010. It says, "We know the Obama healthcare overhaul has nothing to do with healthcare. It's all about control, and specifically population control. In 1973, the Supreme Court found for Roe in an unbelievable 7-2 decision that abortion was legal. Since then, 50 million babies have been murdered in their mother's wombs in the United States of America, where life, liberty, and the pursuit of happiness is promised in the Declaration of Independence." In 1934, FDR created the Committee on Economic Security. It says the CES was assigned the task of studying the need for an economic security system to provide income for the elderly and disabled. Care for those unable to work was traditionally provided by family members or, in limited cases, by the government. Roosevelt recognized the need for a national system, and in 1935, the CES issued a report to President Roosevelt outlining a plan for a national program of economic security. This plan ultimately became the Social Security Act, which was passed by Congress in 1935. It has become a government Ponzi scheme ever since. And yeah, unfortunately, they say, "Oh, don't worry, your Social Security benefits are going to be there. They're going to be there." But, even if they are going to be there, adjusting for the change in the standard of living and that, you're not going to be able to buy shit with it. That's why, your Social Security doesn't do shit for you. You have to get a second, income. You have to go back to work. You have to do something, right? So, it's not and it's forced on you. You don't really have a choice. But this is kind of like this healthcare now. It says, in the summer of 1965, President Lyndon Johnson signed into law Medicare and Medicaid, representing part of his, quote, war on poverty. At his elbow was former President Truman, who was the first to suggest health care for all Americans in 1945. It said, needless to say, this too is a form of Ponzi scheme. And says, here we are, 37 years after legalized abortion, 45 years after the Great Society, and 75 years after Social Security was enacted. Had 50 million babies not been murdered, they probably would have been working Americans today that could have helped to fund the government Ponzi schemes for the now retiring baby boomer generation. And that's what I was getting at as far as the Social Security benefits. There's a whole wave of people that are retiring now and going to be retiring, and there's just not enough money in there. The money's not even there. They're just paying it out, and so it's just kind of sad, because when you think about Social Security and you think about how you have all these people that are going to supposedly get it, be eligible to receive it, I think of eugenics, and that's what this woman is getting to. That's what she's getting at with this. That's what it's all about. Whether it's healthcare, and eugenics, they don't want you to live, a healthy life till you're 100, 150, because you're going to be collecting benefits. And so it's kind of a strategic reason for having things like this going on. And she says, but of course that was not part of the plan. And she goes on to describe what I was saying. The real plan is population control. Now that the baby boomers are old enough to be a drain on the already insolvent Social Security and Medicare, the World Order planners need a program to quickly eliminate the cost of this huge portion of the population. Yeah, we call them useless eaters. Well, we don't, but the elites call us, those type of people, useless eaters, and they need to get rid of them. And whether they do it with wars, or they put stuff in their water, or spray them with chemicals in the air, or put stuff in their foods such as GMO, aspartame, sucralose, MSG, whatever. It's all about bringing you closer to our best friend, Mr. and Mrs. Cancer. And how do they accomplish this plan? Quite simply, government-controlled healthcare would guarantee rationing, especially to the elderly, whose last years are most costly. And I also caught an article from the AP where saying that the children are actually going to be hit by this as well. Eliminate the care, and the elderly pass more quickly without the drain on the government Ponzi schemes. The plan is to eliminate the huge and costly group of baby boomers who are now draining the Social Security and Medicare. It says, Tom Daschle said in his book, the elderly have a responsibility to die, knowing that they are not going to survive their chronic illnesses, so that society can save money and pump funds into care for the younger and more worthy recipients. It says the elimination of the population of the world was started long ago by Thomas Malthus, who lived from 1766 to 1834. In 1798, Malthus, or I guess that's when they talk about Malthusian, that's what we're referring to. I've never read this, but it says he wrote an essay that basically stated population would continue exploding to the point where the earth could not support nor properly feed the burgeoning population. Prior to Malthus, population was considered by governments to be an asset. Malthus said that by 1890, there'd be standing room only in the world. It was Ben Franklin that inflamed Malthus by mentioning in a talk that the colonies were growing at a rate of 3% a year. He couldn't imagine sufficient grains being grown to feed the people at the exponential rate of growth, especially the poor. He felt such a fate could only be avoided by severe measures. The death rate in his country of England was declining because of the Industrial Revolution and better housing and nutrition. Malthus proposed to undo all of this. He wanted to encourage forms of destruction to the population by overcrowding, filth, and the hopes of a return of the plague. His diabolical views are most repulsive, and as an Anglican minister, I believed he enjoyed funerals more than his baptisms. And talks about Margaret Sanger, the co-founder or the founder of Planned Parenthood. Although Malthus was content to wait for natural diseases to check numbers, and he opposed contraception and abortion, Sanger, on the other hand, wanted to totally stop the unfit from conceiving children. She desired the government to sterilize the feeble-minded and insane. Perhaps some of this has been seen in documentaries of those in the 20s and 30s who were simply deaf and were sterilized as they were thought mentally deficient. And Sanger's original organization, called the American Birth Control League, had clinics all over America to, quote, serve the poor and disabled. In other words, kill them, right? And that's what John P. Holdren, the czar, science czar for Obama, director of science and technology, wrote it in his book, educational book. And it wasn't just him, it was someone else as well that co-wrote it, calling for drugging of the water and forced sterilization and one-child policies. And this is the person who is the director of science and technology currently in 2010, who's calling for geoengineering the planet in order to curb global warming. So it says here, of course, the Nazis will adopt the eugenics policies of the United States and, quote, quality control of breeding in Europe. Despite Hitler, John D. Rockefeller III drew up the draft charter of the population control in 1954. Rockefeller and other men of great wealth placed control of population on the national agenda, inasmuch as they were watching rapid growth in Latin America, Africa, and Asia because of the elimination of infectious diseases and the teaching of the ministries. So, yeah, it's a lot of stuff here, but you might want to check this out on your own. But yeah, I mean, it's crazy stuff, this healthcare bill. You know, it's going to be, rationing of care, and the insurance companies are for it. And people say, well, why are the insurance companies before the healthcare bill? Well, the health insurance companies, they don't want to issue care, right? So they're going to be all for this healthcare bill because it basically allows them to, it makes it harder for them to issue care, and then they can do it all in the name of the government. Well, the government says, it's law that we can't provide this and we can't provide that, and we got to do what they say. So then, they're all for it. But yeah, I want to check this out. It's not too much longer, but either way, that's what it's all about, eugenics. So, thank you.